So I'm here today with Tom Walker, and we're talking about motivational interviewing. Tom is really an expert in motivational interviewing, and I know that you have worked with hundreds, thousands probably, of people using the motivational interviewing technique. And I want to get a sense, because I know that you kind of do a lot of work with a wide variety of people.
Mm-hmm.
How do you get them to change using motivational interviewing? And you know, because we're talking from the Traumatology Institute, it's really, how do you get people to change using motivational interviewing after trauma?
Okay. Well, basically, you ask them what needs to happen in order for them to be able to move forward. You ask them questions versus trying to sort of instill a computer chip or fix them, if you will.
Mm-hmm.
So you might ask questions like, if you were to change, what would be good about this?
Mm-hmm.
If you were going to do this, what would need to happen in order for you to be successful?
So you're really kind of engaging them in their own ideas, their own sense of what would get them moving forward, rather than telling them what would get them to move forward?
Well, that's a key component, because oftentimes we think we have to give them all the motivation. Well, motivation is something we do versus something we have, and part of our work is to get them thinking about it, engaged in the process. One example of that is, I might say, on a scale of 1 to 10, how likely is it that you're able to do this? And if they say 4, I'm going to say, wow, why aren't you a 0?
Right, because after trauma, it's really, really hard to be motivated to do anything.
Mm-hmm.
I often talk about that whole issue around motivation, because I find that after trauma, you can't rely on motivation. You actually have to draw from something different than motivation itself.
For sure, and oftentimes when we ask them, why aren't you a 0, for example, they'll start talking about all the reasons they can, versus if I say, why aren't you, instead of a 4, how do I get you to a 5? Well, they might then start talking about all the reasons why they can't.
Kind of
all that difficult.
Speaks well to the issue of how people continue to have this inner resiliency even after trauma, that sometimes they can find deep inside of themselves the place where they can still access not necessarily motivation, but the few little steps it takes to move forward one bit at a time.
Mm-hmm.
Is that kind of how you're using it?
100%, because if we say to someone, how do you get to from a 4 to a 5, they talk about all the walls that they know about.
Mm-hmm.
But when we ask them about the 0, why aren't you a 0, they'll start talking about what they can do, what they know needs to happen, what are possibilities, why they think they scored a 4 versus a 5 or a 6, which when they go there, they often go into all the problems.
Powerful stuff. So is there anything else you do to get people to change using MI?
Mostly it's just primarily checking in with people, asking questions, pulling it from them. There's 3 components that are really key in MI, and that is to be collaborative, evocative, and that people have autonomy.
Beautiful, beautiful. Well put. Thank you so much, Tom.